it's already exciting to see so many people coming from different locations, different areas, different timing. And I understand very well why we have to do it twice, once today and the other time is tomorrow morning. I'll start with showing some slides, and I hope that I'll be able to give you a brief idea on the kind of care that we offer in Gaza, and at the same time to touch upon issues related to palliative care or to care for caregivers or stress management and these other titles, And to begin with, we are a non-government organization that started to operate in the year 1990. We were established by a renowned psychiatrist and the human rights advocate, Dr. Yasser Sarraj. And the idea, when we began, the idea began in the late 80s, because in Gaza, then we had only one psychiatric hospital and there was no other service. It was during the first Intifada, and the question was all the time, how can we provide care to families, to the children who were simply challenged by the daily realities of the occupation, including what was happening during the night, the Intifada, like night raiding of houses, homes, etc., etc., etc. So the idea was to let's begin to try to address the needs of the families, of the children, of the women, of the people who are exposed on a daily basis to the violations of human rights caused by the occupation. In order to do that, to be successful, and after consulting with many international colleagues and experts in the field, he thought that the best way to do things is to just follow a biopsychosocial model of intervention. Now it's sometimes called biopsychosocial rehabilitation model of intervention, etc., etc. But the idea is that we do not really need to focus only on the medical aspect, the biological aspect. But we have to take in mind the psychological aspects. We have to take in mind the socioeconomic conditions, the living conditions, the family conditions, and all other issues that are around the life of the people. Because in a place when you live under occupation, you are exposed to different violations of human rights. You cannot really think of just the biological essence of illnesses. You cannot only attribute depression to a disturbance in transmitters, etc., etc. When we look at Gaza today, which is 32 years from 1990, we see very simple but crazy, if I could say, figures. The population is more than 2 million people. It's not a big population, but it's in a very small geographical area, which is about 360 square kilometers. The density is about 5,000 people per square kilometers, or 13,000 people per square miles. Among those, more than 50% are below the poverty, according to OCHA in 2021. Unemployment rate is almost also 49%. Sometimes it goes up to more than 50%. Sometimes it goes back to about 46%. The other staggering issue is that about 80% of the population are dependent on international assistance. Now, the question is why we are there, why we have such a very dense population. The very big reason, which is that 67% or 2/3 of the population are refugees, who are people who are uprooted from their own living places between until the year 1948. And then that's not the only issue about Gaza Strip. If you think really about the place, you will have in your mind different things that you could think of. It's not only the occupation, it's also a siege that is embarked, or a blockade that began 15 years ago and continues until now. Restriction of movement, some of the goods are not allowed to get into Gaza, etc., etc., etc. It's not only that you have the highly densely population with 2/3 of them refugees. It's not only that you are living under blockade, but also within those 15 years, we were exposed to 4 military operations, or 4 what we call offensives. One in 2009, the other in 2012, the third in 2014, and the last one was in May last year, 2021. Sometimes we call them 4 offensive, sometimes we just count the days. 2009 it was 22, 2012 was 8, 2014 52, 2021 11 days. So sometimes we sum it as days, sometimes we just call it as different offensives. Why I talk about this? Because of the very simple issue, which is that between those attacks, we as residents, we really do not feel that we are safe. It's not getting back to a safe area, to a comfortable living zone. Why? Because the blockade is still there, the occupation is still there, the economic hardship is still there. Every now and then there are expectations that there will be another attack. So people are all the time feeling that as if they are living on the edge. That's why in 2018, there were a lot of demonstrations in Gaza that continued for about a year. Great March of Return demonstrations. Those were mainly civil demonstrations. However, the harsh response by the Israeli army caused thousands of people who got wounded, tens of amputations, more than 7,000 people with life ammunition wounds, etc., etc., etc. So there are some other difficulties that we are facing, and like the international community, we had our own share of COVID-19 that continued for 2 years, and now, by the way, we are on the edge of the 5th, let me say, wave. It started about a few days ago. Of course, with each thing, you have a number of people who were killed, who were wounded. Usually 1/3 are children, usually 1/4 are women, usually 70 to 75% of the people who got injured, killed, wounded, etc., etc., who are basically civilians. One would say, how are people dealing with that? How is the psychological impact? I'm not going to focus on this for today. I'm going to focus more on care. But for example, a report, I'd like to ask everyone to look into the reports that are shared by various actors, international actors and local actors in Palestine, commemorating, for example, 15 years of blockade. For example, Save the Children issued a report less than 2 weeks ago. Among the key findings, I picked 2 because they are very important. The first one is that regarding children, imagine that 90% of children feel less safe when away from their parents. So the concept of safety is still a big challenge and a big issue in a place like Gaza Strip, although these data were collected 10 months after the last Me attack. It was in March and in April. On the other hand, the caregivers, and this is again another challenge, caregivers, we speak about here parents when it comes to children, about 96% of them, they feel unhappy and constantly anxious. When we ask why you are feeling unhappy or constantly anxious, of course, because there is nothing that you can do in your hand. 63% of caregivers feel they are not useful. 61% report inability to overcome difficulties. Difficulties not only the crowdedness, the housing, but also difficulties with socioeconomic conditions, with just affording a good life for their children. Now, when you come to a place like Gaza Strip, the question is, who are the people who are providing some care? This intervention pyramid is widely used nowadays in humanitarian, let me say, response. It begins with a very wide title of social considerations in basic services and security, and ends up with the specialized mental health services, which is therapy and care. And in the middle, there are different interventions, more like counseling, more than specialized support, sort of this and sort of that. In a place like Gaza Strip, the Ministry of Health, mainly with GCMHP, are involved in the provision of specialized mental health services. But imagine that the overall number of therapists who can provide this service in both organizations or institutions is less than 200 people. When we speak about a population of 2 million people, we speak about less than 20 psychiatrists in both areas. So you can imagine how difficult or how challenging it is to provide care for the people who are in need. Of course, in the other layers of intervention, the more, let me say, basic ones, you have many local and non-governmental organizations, international non-governmental organizations, and many other key actors. And then I'd like to begin to show this photo, or this, I don't know how to call it. It's imagery that was provided by one of the international organizations. It shows how, or areas that were attacked or targeted during the 2021 attacks. The idea is that this is slight or very small geographical area, Gaza Strip, which is about 6 to 8 miles in width, or maybe 14 to 16 kilometers in width, and about 40 kilometers in length, or 26 miles in length. Sorry about that. You see that almost every place was attacked one way or the other. So the bombardment, the shelling was felt, was heard almost everywhere. So this is the southern area. You can see in green or in yellow or in orange that areas were bombed during the 11-day attack. If you go a little bit to the north, to the northern area, you will see that the same things happening. It's even more dense. So we do not speak only about providing care for people who come to your community centers, the traumatized ones, because not many of them come to your place. Why? Because a population of more than 2 million people, where almost everyone exposed to some sort of traumatic event. You know, the exposure level to, for example, hearing bombardment, being terrified, sometimes go to, according to some research, to more than 97%. And then the question is, what have I done? Now the question is, next slide. When you have a crisis, you know, building on another crisis, when you have an acute condition building on a chronic conditions, what can you do? You know, and when you are in GCMHP, Gaza Community Mental Program, expected to start to have a crisis response plan. Of course, we do the very main things. You know, we begin with the very basic thing, which is the provision of psychological first aid. It's an internationally accredited, known, let me say, standardized technique that you need to provide immediately. When you speak about 2 million people, you cannot, of course, go to visit everyone. What can you do? You need basically to identify the key or the main people who were affected. Main people, which means the most exposed people. That could be the neighborhoods that were more bombed than the other neighborhoods. It could be families of the injured people, families of the killed people or wounded people. And then there is a big question about, we need to offer more help. We need to offer more accessible help. So you try to have a toll-free line, you know, where people can call you, especially in a place like the Middle East. There are some issues with stigma. Mental health is something that is stigmatizing, was stigmatizing, and will continue to be stigmatizing wherever you are. So you need to keep this in your mind, and you need to offer some space for people who could approach you to make sure, or to ensure that, are they in need for your service or not. Telephone counseling is another important service that we expand. It continues to be there, but we expand during the crisis, which means adding more staff, adding more time, operating during the weekends, etc., etc. And then you have to send your community, your teams to the community, because you need to visit houses. We usually send pairs of a man and a woman, both psychologists. They go to visit the houses. They start with the most affected areas, and they try to provide basic counseling, some assessment, and detect cases that need more care, and refer them to our community centers, where we provide specific counseling or therapy, the traditional, let me say, psychiatric, psychological, therapeutic approaches. Now, at the same time, let's say that having in mind the previous, let me say, map of Gaza Strip, where everyone was affected, we will notice that even the ones who provide care are or were exposed to the traumatic conditions. Because when you see that the parents say that we feel that we are useless, we cannot help, we couldn't help our children, feel them protected. Well, I had the same feeling. I couldn't really protect my children. I couldn't tell them that everything will be fine tomorrow morning, because they know that we will not, it will not be for sure okay until or normal or good until there is a ceasefire that is reachable. So for that, we need to, we have a different or another pyramid, if I could say, which is to work with caregivers. And this is again a multi-layer intervention. Psychoeducation, you need to tell everyone the lessons that they need to understand, especially to parents. You know, when your child starts to behave in a very abnormal way, you need to make sure that you understand that this could be a sign of a trauma, and that with listening, with offering more hugging, with offering more containment, then your child will start to improve. You need to tell the parents, to send them the message, to send the message to the whole community, what they should do, how they should react. And then you speak about people who are in the front line, you know, and this could be medical staff, this could be mental health workers, and this could be ambulance drivers, and this could be journalists, for example. This could be civil defense actors. Here we have two modalities. One is stress management, which is basically to have 1 or 2 sessions for stress management every now and then to help them know how to deal with their stresses, how to ventilate, how to, for example, to make or provide deep breathe, etc., or breathing exercises, etc., etc. Some of the organizations, they are not really into a systematic program that offers care for caregivers on, for example, weekly or bi-weekly basis. That's why we end up just having some stress management, we call it, session every now and then, based on their request or based on the need of people. However, more structured is the very important thing. And for that, we have either care for caregivers, which is like a session each second week, or we have something that is called supervision, which is aimed at mainly mental health providers, because as a mental health professional, you need at the end of the day to empty your cup in order to be able to provide more people, because you see cases on everyday basis. You hear the difficult stories. You have lived through these conditions. You understand really what it means, and you are expected to provide care. You need all the time to empty your cup before being able to take more information, listen to more people, and of course provide more care. Without this parallel system, the first one will never work. You cannot really help others when you feel that you are paralyzed, when you feel that you don't have anything in hand that you could provide to your family, to yourself, and to everyone else. These are some of the pictures, some of the photos. These are ambulance drivers. We have provided throughout 6 months period stress management and care for caregivers for the mainly stress management to almost everyone in the ambulance drivers field in the Ministry of Health. Those are, I think, 190 people. And part of it was fun, part of it was talk therapy, part of it was building, let me say, group dynamics, and it all went really very well. And imagine when we speak about decades of those difficulties, that was almost the very first kind of, let me say, help that they received in a very systematic way. So it's very important all the time not to think of one-shot stress management, but it's all the time, it's important to provide something for at least 3 months, maybe 6 months period, in order to feel that you have done something good. There are some other issues, you know, you need to ensure accessibility when you provide care to the whole community. We have 3 main community centers. Those are in blue, light blue, but also we are present in some community-based organizations. We send psychologists to operate from there, and these are 1, 2, 3, 4, 5 areas. So we can find 5 access points or 5 accessibility centers to our community centers, while traditionally we used to have only 3. Of course, this is in addition to our toll-free line. These are some of the colleagues who are visiting some of the families in the field. And this is one of my colleague, a psychologist, who is working with an 11-year-old girl in our play therapy room. So this is in short what I would like to say, but I would like to end up with Save the Children report. It says that reversing the impact of the current living conditions, there are needs for 2 things. One, is to put an end to the most significant stressor in children's life, which is the conflict itself, the violence, the economic deprivation. The second is to help the people cope, improve their resilience, and be able to go on with their lives in Gaza. And I, as a Palestinian who live in Gaza, I would say that none of those will be able to be achieved without ending the blockade and putting an end to the ongoing occupation that is going for decades. Thank you very much.